If you are in the gym, it may be a good time to start heading over and grab your seats for our physician panel. That will begin in about 15 minutes. Again, we'll have 4 physicians from Henry Ford Allegiance Health, our heart and vascular team. They will be presenting starting at 9:30. So again, in about 15 minutes, if you want to start heading towards the sanctuary to grab a seat, that would be a great time to go. Good morning. In about 5 minutes, we will have our physician panel starting at 9:30 in the sanctuary. So you may want to start heading over if you're in the gym area, again to the sanctuary to grab your seats for our physician panel. 4 members from our heart and vascular team will be presenting their information. Again, good morning, everyone. Welcome to the 16th Annual Heart and Vascular Expo. We will have our physician panel starting in about 3 minutes. So if you're in the gym area or if you're in the commons area, now would be a great time to go grab your seats. That physician panel will be taking place in the sanctuary. We'll have 4 of our doctors from our heart and vascular team presenting. Again, the physician panel will be starting in just about 3 minutes in the sanctuary. You want to head over there right now and grab your seats. Good morning. Welcome again to the Heart and Vascular Expo. Our physician panel will begin in about 1 minute inside the sanctuary. Again, the physician panel will starting at 9:30 in just about 1 minute.
Good morning. We're going to begin our heart and vascular table and conversation with our physicians. If you want to make your way, one last call to make your way over to the sanctuary. We're going to begin our question and answer session with our physicians. I am Sue Cross. I am the clinical director over cardiovascular services at Henry Ford Allegiance Health. I want to welcome all of you. This event has been going on for 16 years, and we're so excited to watch it grow and have all of you here and be able to meet our physicians a little bit closer and ask some questions. I'm going to introduce them first. They will then say a little spiel about the things that they do and have some information for you, and then we'll go to the question and answers. And we will, just a real quick question. We have cards for them to fill out, right? I'll get that for you. So first, let me introduce Dr. Jordan Nepper. Dr. Nepper is the medical director over the cardiovascular service line, and his specialty is vascular surgery. He has going to be talking about the service line growth in vascular services. As a vascular surgeon, Dr. Nepper is the expert in the blood vessels of all parts of the body except the heart. He has specialized training in complex aneurysm and minimally invasive peripheral and cerebral vascular disease. All of these affect the harder to access blood vessels going to the brain. Dr. Nepper is also trained in and has FDA approval to use the new minimally invasive implant devices to treat aneurysms. Next on our panel is Dr. Elizabeth Pielsticker. She is the medical director over Henry Ford Allegiance Health Cardio Cath Lab. Let me just start over here. It is Saturday morning. She is the medical director over our cardiac catheterization lab. Her specialty is interventional cardiology. She will talk today about cardiac arrest versus heart attack and coronary artery disease. As an interventional cardiologist, Dr. Pielsticker performs tests and non-surgical procedures to help people with blocked arteries and avoid having to have open heart surgery. The most common test she performs is a cardiac catheterization, which gives her direct information about blood vessels and blood flow patterns within the heart. If a blood vessel is blockage is detected, Dr. Pielsticker can often perform angioplasty at the same time to open up those arteries. Our next doctor on the panel is Dr. Timothy Shin. He is the medical director of our electrophysiology department. He has specialty in AFib, pacemaker, and defibrillators. Today, his topic will be AFib and sleep apnea. Dr. Shin's area of cardiology concerns with the electrical activity of the heart. He has more than 20 years of experience treating heart disease, congestive heart failure, and abnormal heartbeats. He also participates in national clinic trials examining new technologies to treat congestive heart failure and prevent sudden cardiac death. Our last physician on the board is Dr. Vincent Simonetti. His specialty is cardiothoracic surgery. His topics today will be coronary artery bypass. As a cardiac thoracic surgeon, Dr. Simonetti operates on the heart and specializes in surgical management of heart disease. This is what people think of when you say open heart surgery, where we use the heart and lung machine to stop the heart's activity so we can work on it. The surgery he performs most often is coronary artery bypass grafting. This involves taking vein from the leg or an artery from under the breastbone or arms and uses it to reroute blood around the blocked arteries of the heart. All of these docs are here to discuss their topics and answer some questions that you guys will have. I'm going to hand this over to Dr. Nepper right now so he can say a few words about our upcoming opening of our hybrid OR room.
Good morning, everyone. Thank you for coming. Thank you for that great introduction, Sue. I'm Jordan Nepper. I'm a vascular surgeon, and I'm privileged to serve as the medical director for cardiovascular services for Henry Ford Allegiance Health. We have really big things coming in cardiovascular services to the Jackson community. Over the last year, we've brought on board nearly a dozen new procedures in heart and vascular care. We are able to keep people home in the Jackson community, not having to go to Ann Arbor or Detroit for their care. And I'd like to announce that in 2 weeks, the most advanced operating room in the state of Michigan will be opening in Jackson for a multidisciplinary team, everybody on this panel, to use to treat our patients for their advanced heart and vascular disease. This room is a $5 million investment in our community and represents a technological peak in cardiovascular care for the Jackson community. This will allow us to do structural heart procedures that we have not been able to do, vascular procedures, aneurysm repairs, atrial closure procedures in ways that are safer, faster, and more efficient for all of our patients. In addition, we've made investments in outpatient infrastructure, heart failure, structural heart disease, and we'll soon be bringing on our heart failure team from Henry Ford, Detroit, so that we can get our world-class heart and vascular care at home. So thank you for coming.
Hello there, I'm Dr. Liz Peelsticker. I'm the medical director at the Cath Lab, and I'm privileged to talk to you about coronary artery disease today. Just a little bit of information about the Cath Lab. We currently have 3 Cath Labs available, and we are about to undergo renovation of one of those Cath Labs to decrease our radiation exposure to patients and our staff. We also, as Dr. Knepper talked about, we have the hybrid room that will be opening up in the next month, where we will be doing cardiac procedures, vascular procedures in there. And then there are plans for a 4th Cath Lab in the next couple of years. So we are really growing our services, and as Dr. Knepper said, are able to provide more and more services to our patients here in Jackson and the surrounding areas. We have added TAVR, and I think that Dr. Simone will be talking more about this, but it is less invasive surgery to replace the aortic valve instead of doing the traditional open heart surgery, going in typically through the leg to implant a valve within your original valve for a blocked aortic valve. We've also started doing PFO closures, which is a connection between the 2 top chambers of the heart that allows blood to go back and forth, and we can now close these defects here in Jackson. And then we've also initiated a program to open up chronically occluded or chronically blocked arteries, which is a more difficult procedure than just opening up a 70 or an 80 or a 90% blockage. So new things on the horizon, and we are happy to provide these services.
My name is Timothy Shin. I'm a cardiac electrophysiologist, which translates essentially to I'm the heart's electrician. Although we've been doing cardiac electrical services here in the Jackson community now for 15 years. In the past year especially, our breadth and scope of services has expanded tremendously with the support of the hospital in regards to obtaining some state-of-the-art equipment, as well as their supports. Right now, from a per-physician procedural volume, we're one of the highest in the state for one of the most cutting-edge problems, which is atrial fibrillation and atrial fibrillation ablation. We are embarking, as mentioned earlier, I've been involved with a number of international trials looking at sudden death and defibrillators and pacemakers. From a Henry Ford system approach, we are now embarking on making long-term relationships such that as an entire system we can provide some state-of-the-art technologies to all of the patients involved with Henry Ford before they'll be available to anybody else. An example would be some of you may have what's called a leadless pacemaker. I was the first to implant in the state of Michigan, and what has currently now been just approved is a newer version of that, and the Henry Ford system was tagged as the first adopters in the state of Michigan. So we will have it available before anybody else in the state, including the institutions where I was located before, where we first implanted the original leadless pacemaker. So the collaboration that's been present and supported has been amazing and very fruitful. Vince.
Good morning. I'm Dr. Vincent Simonetti. I'm one of the cardiothoracic surgeons here in town. Many of you know me already. Most of you do not want to know me because I'm the end game for a lot of what the other physicians are talking about. Most of our endeavors these days are to limit what I do because it's invasive, but Dr. Maka and I brought this technology to Jackson 12 years ago because it is necessary, even though we all try to avoid it and nobody wants it. It is life-saving, and to this point, we've operated on over 2,000, closer to 2,400 patients that have no longer needed to leave our community to get this treatment. So what we do is open heart surgery. It's invasive, and it's often referred to as cracking your chest open, but when these other technologies aren't amenable to repair the heart, for instance, if there's too many blockages that Dr. Pielsticker can't open with stents or balloons, and they're in locations or of characteristics that a balloon won't open them up, then bypass surgery is still the optimal treatment to preserve and lengthen your life and prevent heart attacks. And to do that, we use a heart-lung machine to assist us in stopping the heart from beating and rerouting the blood around these blockages, as Ms. Cross said earlier, with veins from the leg, arteries from under the breastbone, arteries from the arms. We also deal with valvular heart disease, where valves, the two predominant valves we work on are the aortic and the mitral. The aortic valve is a very explosive field right now with the advent of a valve that Dr. Pielsticker mentioned is a TAVR valve that stands for aortic valve replacement through the groin with a catheter, very similar to where you open up an artery with a balloon. This is where you open up a valve with a balloon technique, and you don't have to have your chest cracked. Now, that's a multidisciplinary endeavor where the surgeons, Dr. Maka and I, are involved with the cardiologists, both from Jackson and from Detroit. And it's an evolving technology that's really taking off. But at the same time, same way with stents treating coronary arteries, there's still a need for occasional patients having open heart surgery, and that's why we're here. Mitral valve is usually a leaking valve, not a blocked valve, and frequently we can repair that valve without actually cutting it out and replacing it. And there's a host of other reasons for open heart surgery that we're available here in Jackson for, and we're continuing to expand our skills and technologies to serve you. This new hybrid room that Dr. Nepper mentioned is another interesting evolution, in that hybrid means it's a combination of an operating room, the regular kind of operating room that I work in every day, and a catheterization lab, which is a regular catheterization lab that Dr. Pielsticker works in every day. And it's all in the same room with all the technology combined. So we can do procedures that involve both operating and catheters and interventions. So that just allows us to expand that much more on our techniques, skills, and procedures that we have to offer. And I'll leave it at that.
Thank you all. Now, we have collected some questions from the group before here, so they filled them out when they were walking in. But there will be people collecting the questions that you guys have, so we'll get those intertwined with these also. One of the first questions we have for our panel of experts is, why can some people know that they are in a different rhythm while others cannot tell? Probably Dr. Shin?
Everyone's different. That's going to be my answer. And really, it is very much just that. Some people can feel, other people don't feel the abnormalities simply because of the way that our bodies are wired in terms of to sense abnormalities. Sometimes abnormal heartbeats trigger reflexes in some people that make them much more conscious of them. It can make it such that they become lightheaded or short of breath or weak or tired. But other people, it doesn't trigger those same reflexes, in which case then they have no symptoms whatsoever. Unfortunately, in cardiology, we've relied much upon symptoms and thought that if you had no symptoms, you did not have the problem. Well, it turns out with heart rhythm conditions, lack of symptoms does not equate to lack of problem. So once a diagnosis is made, we're always very aggressive about trying to treat the condition as well as, more importantly, the person who has that condition.
Thank you. Here's another question here. You hear how important it is to have arteries opened if a blockage. Why can some people be scheduled while others are emergent?
So I'll take that one. So coronary artery disease is a disease of the arteries that supply the heart with blood, and they're called coronary arteries. So coronary artery disease is some plaque buildup within the arteries that may be mild and not obstructing the artery, but something that we should treat aggressively to help prevent that from getting worse. It may be, and it can get worse slowly over time, or it can get worse suddenly. So when it gets suddenly worse, we are frequently doing an EKG, and those patients who have a characteristic finding on the EKG of a complete sudden blockage are taken to the cath lab emergently, and our goal is to get that artery open with balloons and stents within 90 minutes. To abort a heart attack, and that is a life-saving procedure. So there are other times where you can have a 98% blockage or a 95% blockage that develops a little blood clot on it, but it doesn't have a characteristic finding on the EKG of we have to get that artery open now. It may have resulted in a blood test abnormality showing a heart attack. So those patients should get to the cath lab, but it's not an emergency procedure necessarily where we have to get that artery open within 90 minutes. But it all is a continuum. So you have mild coronary disease, moderate coronary artery disease, which is usually still treated medically, severe coronary artery disease, and our treatment options for severe coronary artery disease involve sometimes are medications. Let's say you've got a chronic total occlusion where you've built your own bypasses, we call them collaterals, around that vessel, and you're doing well on medications. We might just continue with medications. If you're still having a lot of symptoms, we might electively open up that artery in our new chronic total occlusion program. But in all circumstances, we're using medications to help prevent blockages from getting worse. But we may be doing stents, as Dr. Simonetti talked about. There are certain circumstances where bypass is clearly better than stents, and those conditions include severe disease in multiple vessels, especially in diabetics or people with decreased heart function.
Thank you. The next question is peripheral vascular disease versus coronary artery disease, and can we have routine scans and testing to help us avoid those?
So I'll start on this one. So peripheral vascular disease, just like the coronary artery disease Dr. Peelsticker mentioned, is atherosclerotic plaque, which is really a mixture of cells filled with cholesterol deposits that die in a specific layer of our blood vessel. And over time, they can get more narrow. Sometimes we can have an event where they completely block things off. And I think thinking of these as separate diseases is not accurate. This is the same disease. The deposits occur pretty much evenly throughout the body. So if somebody has peripheral vascular disease, they definitely have coronary artery disease. If somebody has coronary artery disease, they likely have peripheral vascular disease. It's just where is the event going to strike. So screening itself in people without symptoms has not proven to be beneficial. But things that we can all do is make sure our cholesterol screenings are done and make sure we're on appropriate medications. If we have symptoms, and symptoms of peripheral vascular disease are calf cramping when we walk, sores that don't heal, pain in our legs at night, chest pain with exertion would be symptoms of coronary artery disease. If we have symptoms, early treatment and medical treatment for those save lives and limbs. Whereas people without symptoms getting routine screenings has not shown to be beneficial in many cases. That being said, if somebody is a smoker with multiple risk factors, we offer free screening programs through Henry Ford Allegiance Health, and those can be scheduled in the vascular lab or on the website. So thank you very much for your question.
So I mentioned medications. The medications help in all vascular beds, which is why they're so helpful. As Dr. Nepper says, when you have coronary disease, you have vascular disease. When you have vascular disease, you have coronary disease. Where I can put in a stent in the heart arteries, that doesn't help your legs, but the medications do from head to toe.
Thank you. Dr. Simonetti, I believe these questions, I'm going to group them together. Exactly heart bypass surgery versus open heart, a little bit more clarity around that, but also some signs and symptoms that you may have, and also how long, if you do get that surgery, how long does that bypass last?
Heart surgery for coronary artery bypass grafting is what we would call a misnomer. Open heart surgery began back in the 50s when the predominance of problems with the heart were on the inside of the heart, whether it was a hole in between the chambers or a problem with the valve. And the surgeons back then would go on the inside of the heart, which is what we still do for valvular disease that I talked about, aortic or mitral valve. But the coronary arteries are actually on the surface of the heart, so we don't really open the heart. So it's kind of a misnomer, and it's a term that just comes to any heart surgery these days, where we go through the breastbone. Sometimes we go through alternate incisions. But let's just call it heart surgery, and that'll clarify that question some. So the coronary artery heart surgery is where we reroute the blood around the blockages. We don't take the blockages out. We don't open up the blockages. We use arteries and veins to create bypasses or alternate routes for the blood that don't have to go through the blockages to get the oxygen and nutrients to the heart muscle so that it can beat. And as we've said, it's kind of a last resort opposed to stents, which actually do open up the blockages when the stents are not the best treatment. And as Dr. Peelsticker just said, that's generally multiple blockages, diabetic patients, low heart function patients, and just general blockages that aren't amenable to stents. We get long-term efficacy with the bypass surgery. So what does that mean, long-term efficacy? So The main benefit of bypass surgery is through the use of the artery out from under the breastbone. That's called the left internal mammary artery. When we put that on the main artery on the front of the heart, that's called the left anterior descending artery. If we were to only do one bypass, that is the one that saves the most lives and prolongs your life the most. That bypass is open at 10 years more than 90% of the time. Everything else we do has kind of had a stepwise less effect for a number of reasons, both because the quality of the conduit, which means the vessel that we use to create the bypass, and the quality of the target, which is the artery that we put the bypass onto. So there's a stepwise less benefit for all the other arteries we bypass. And for arteries from the arm or the second artery from under the breastbone, we have maybe 75, 80% open arteries after 10 years. And for veins, maybe it's all the way down to 50%. And there's a multitude of factors for that. Now, if the bypasses are blocked after a certain number of years, that doesn't mean that you have a heart attack or don't survive. The overall survival after bypass surgery is very good for many years, and the likelihood of having to have another bypass surgery is very low because, again, stents and balloon angioplasties can be done even after bypass surgery. So, as Dr. Shin said, everybody's different, so we don't know exactly. It's not a black and white, you had bypass surgery and you have a warranty for 10 years. It's the same way that you form the blockages in the first place, you can continue to form blockages in both the arteries and the bypasses. Bypasses are a treatment, it's not a cure for coronary artery disease. So even though you've had bypass surgery, if you take care of yourself, as we've been mentioning, medications which include aspirin, a cholesterol pill, a blood pressure pill, most commonly known as beta blockers, exercise, watch your cholesterol levels, watch your diabetes levels, you're going to make these bypasses last much longer and help you to live much longer.
Thank you. Dr. Shin, a question for you. Talking about loop recorders, if you could explain a little bit and how they help identify arrhythmias and different things that we would notify a patient for.
Well, a loop recorder first started out as an external device. People would come in with symptoms and they'd say, so what are my symptoms, or what's wrong? I have these symptoms. And unfortunately, my answer would be, I don't know. Because I don't know what your heart was doing when you had those symptoms. And so they came out with these devices that would record the heart EKG. And the first ones that came out were called Holter monitors. And the old days, they had a tape inside, and because they had a tape, they only lasted about 24 hours. And patients literally had to, the thing would shut off, they'd have to take the old tape out, put a new tape in, and they deliver us a package of tapes. That's all fine and good, but we only got 24, maybe 72 hours worth of information, and most of us hopefully don't have symptoms every day. And so then they just devised a different method called a event recorder. Now, an event recorder had the same tape, but it recorded continuously. But then it overrode itself, so it was a big loop. And that's where that term loop recorder came from, because it was a looped tape that erased unless there was some reason why there was a marker put on it to not erase. And so in an event recorder, a patient typically wore it for a month, and whenever they had symptoms, they would press the button. And at that point then, it would record and store that information. And then we could at least say, well, when you had your symptoms, this is what was happening. Once again, it was a month, and if anybody in this room has ever worn a loop recorder or Holter monitor or any type of monitoring in the hospital, it's not infrequent you get a rash. And that's because those electrodes have a silver nitrate compound that's very irritating on the skin. And people don't like to wear them. Well, just think if you needed to wear it for more than a month. So the next evolution of these were what we called implantable loop recorders. And this is all because of digital technology. In other words, what you see in your phone. So if you look around, there are a couple of people taking pictures, and they've got these huge cameras. Well, and then other people are taking pictures with their camera phones. Well, what's happened basically is computer technology has gotten so good that we can now have loop recorders which we literally inject underneath the skin. And they're battery operated, and they last for 3 years. And we program in parameters that it automatically records, and people can actually have another device which they put over it, and it adds that same marker channel. So what it allows us to do is both a Holter monitor type of function as well as the loop recorder function. And this for up to 3 years worth of monitoring. And the reason this is important is because people get conditions which don't happen every day or even every month, or they don't even know that they happened. One of the most interesting applications of a loop recorder that was implanted was they looked at people who had strokes with no reason. In other words, someone came to the hospital and had a stroke, and they couldn't figure out why. We call that a cryptogenic stroke, which means I don't know why you had a stroke. So we started implanting these recorders in them. And what we found is that in about 25% of these people, the reason why they had a stroke is they had atrial fibrillation. And if we hadn't known that, those patients would never have been treated appropriately, and they would have had their second stroke, which could be devastating versus a tiny mini stroke. So the loop recorders we now implant, once again, we literally inject under the skin. I typically tell patients it takes about 10 seconds to put in. Most of the patients just get medicine to numb up. They don't even get sedation. We just chat, and then I tell them we're done. And then they go home. At that point, then we just monitor them along, and we monitor remotely. They don't even need to come into the office. We monitor them directly from home.
Thank you. Dr. Nepper, the question here is, you've mentioned doing less invasive surgeries for the carotid. Could you give a little more detail to that new technology and new process that we brought here to Allegiance?
Sure, great question. So the traditional surgery to fix carotid arteries, and this is done to prevent strokes in many people, is an incision in the neck where this plaque is scraped out, and then we sew on a patch made out of cow heart material to make it wider than it was before. And this is a great operation for many people. Then came the advent of stents, which we thought was going to be a great technology to treat carotid disease. And it turned out when we compared them head to head, the stents caused 3 times more strokes than the old-fashioned surgery. So for the last 5 or 6 years, people have looked for ways to mix the two and get the minimally invasive benefits and fast action of the stent with the low stroke rates of the surgery while not having some of the drawbacks. So at Henry Ford Allegiance Health, we offer a procedure called TCAR, which is transcervical carotid artery revascularization, for which we were the first in the state to implant the commercial device. And what this does, it makes a small incision at the base of the neck. We use a special set of tubing and filters to actually suck the blood out of the brain for 5 to 10 minutes to try and make it so any debris breaking loose doesn't cause a stroke, while we very precisely place a stent. So we get the benefits of being right there with the surgical approach in a very small incision, the quick action of the stent with a new protection by being able to essentially suck away any debris that might cause a stroke. And that's that has resulted in a procedure that has a 1 to 2% stroke risk rather than a 3 to 5% stroke risk or a 10% stroke risk with other procedures.
Thank you. Can someone have a heart attack without blocked arteries? And does heart failure cause the same or act the same as a heart attack?
So, yes, you can have a heart attack without blocked arteries. And some of the mechanisms for that include spasm, so vasospasm, and smokers and women are more prone to that. It can be related to small vessel disease. So when we do a heart catheterization, we take a look at the main arteries and their branches, but it could involve the tiny sub-branches that we just can't see. So those are the main mechanisms for having a heart attack. There are also heart attacks related to the coronary artery disease, but there are also other heart attacks related to a supply and demand mismatch. So when you're born, you have a blood supply up here and a demand down here. And anything that shifts that out of balance can result in a heart attack. So blockages reduce the blood flow. And if you reduce the blood flow enough, then you can have a heart attack. But other things, if you have a moderate blockage that reduces the blood flow a bit, but then your demand for blood goes up, that can result in a heart attack. And some of the things that can make the demand for blood increase are things like having atrial fibrillation with a rapid heart rate, so heart rate of 180 or 200 beats per minute. That can raise your demand for oxygen above the supply. And then we can see evidence of a heart attack on our blood tests. Other things, anything that stresses the system, like pneumonia and decreased oxygen levels in your bloodstream. Again, if you decrease the blood supply or the oxygen in your blood, you can shift that balance. So there are different mechanisms for heart attacks other than just an out-and-out blockage. And then the other part of that question was cardiac.
Is heart failure the same as a heart attack?
Is heart failure the same as a heart attack? Okay. Heart failure is not necessarily the same as a heart attack. A heart attack is typically lack of blood flow or damage to the heart. Heart failure can be a result of a heart attack and is usually a result of a heart attack, where the heart attack decreases the ejection fraction of the heart. So normally the heart ought to squeeze at least 55% of the blood that's in it with each heartbeat. But if you have a heart attack and now your heart is only squeezing 20 or 25%, then the heart is not effectively moving the blood within the body, and the blood can back up into the lungs, create high pressures in the lungs, which causes shortness of breath. It can cause fluid to collect in and around the lungs. And then if that puts extra pressure on the right side of the heart, you can have fluid buildup in your abdomen or your legs, so swelling. You can also have heart failure without having had a heart attack, and some of the mechanisms for that include viruses, certain drugs, certain chemotherapy medications. So you can have one without the other. They're not the same.
Thank you. Dr. Simonetti, you mentioned cracking the chest. Why would I have my chest cracked when I can have a less invasive TAVR procedure to repair a valve?
Excuse me, the short answer is you wouldn't. If you can have a TAVR these days, it is a very good treatment. Now, it's an evolving treatment, and we don't know all the long-term outcomes of this procedure. So we always have to balance the risk and the benefit. The main limitation of TAVR these days is going to be the durability of the valve. We don't know exactly how long they're going to last, and if you're 85 or 90 years old, if we get 5 to 10 years out of a TAVR valve, then that's all we need to do, and we're good. If you're 60 years old and you need a new valve, and a TAVR valve only lasts 5 or 10 years, then we're talking about 3 or 4 different valve procedures over the course of your life, and maybe that's not ideal. The typical surgical tissue valve, which is comparable to a TAVR valve, we expect to last 15 to 20 years. Whether we're going to get that long of durability out of the TAVR valve, we're not sure yet. The other kind of valve that we have for open heart surgery is a mechanical valve. Now, not many people opt for a mechanical valve these days because you have to be on blood thinner Coumadin for the rest of your life when you have a mechanical valve. But the advantage of a mechanical valve is they don't wear out. There are a small number of incidents where they may run into trouble with leakage around the valve or scar tissue around the valve. But when we put in a mechanical valve, it's expected that that's the one procedure you're going to have for the rest of your life. So it's a balance of how many procedures you need to have for the rest of your life. And the other decision-making process is can a TAVR physically be put in the patient? Because there's more limitations to implanting the TAVR than there is for open heart surgery. For the surgical valve, again, we surgically divide the breastbone, is the way I like to say it, not crack the chest. And we have access to the heart. We cut out the old valve and we sew in a new valve. There's not too many limitations to us being able to do that. For the TAVR valve, we have to put catheters and wires up through the groin. So if you have peripheral vascular disease, those vessels may be blocked and we may not have enough room to get up through the groin. We have to go around the arch of the aorta, which is the turn that where the head and neck vessels come out. So there's risk of stroke there if there's some anatomical conditions that can limit that. We have to get that valve across the old valve, and it has to be blown up with a balloon and fit in place. So there's anatomical limitations which are few but significant when they're present. So we have to physically be able to do the procedure of a TAVR as well to avoid the surgical valve.
And just to add, it is safe to say it's a whole team effort in decision making. It's not just cardiac surgery or cardiology, but they all come together through different tests, and then the team sits and talks about the patient and really develops the best plan for the patient. Is that fair to say?
That's an excellent point. In fact, the reason this evolving technology is in Jackson is because of our affiliation with Henry Ford Health System. This is a very challenging technology that demands a lot of experience, both by surgeons and cardiologists. And we've done upwards of 30 in Jackson so far, but the Henry Ford Health main system in Detroit has done thousands. And we video conference with them every Monday on our patients as well as their patients to have a collective experience of some of the world's experts with this procedure. So we're very fortunate for that.
Thank you. Dr. Nepper, what are varicose veins and what are the treatments for those?
So that's another great question. So just as we talked about valves in the heart, we have valves in other parts of our body. Veins are the blood-filled tubes that return blood from the organs and the legs to get recharged with oxygen. And the challenge with that is keeping everything going in the right direction. So we have valves that keep things from leaking backwards. Varicose veins occur when these valves break and blood leaks in the wrong direction, and we're now forced to store blood in places it's not supposed to be. So varicose veins are now dilated storage veins that should not be there. The reason why those are treated and considered a medical disease is 2 to 3% of people with varicose veins will go on to developing sores that do not heal. They develop pain in their legs that make it so they cannot work normally. and they develop swelling that can have other complications. So in most cases, a minimally invasive procedure that involves radio frequency or laser sealing treatments can be utilized to prevent those ulcers and improve quality of life.
Thank you. Dr. Shin, the question is, does AFib disable a person and give life-changing restrictions? And is there a procedure to help AFib? I hear a lot about the Watchman procedure. Does that help AFib?
In regards to atrial fibrillation being a disabling condition, it will vary from individual to individual. Some patients will say that they feel disabled, others will be completely unaware. And so in that sense, we approach it from a case-by-case approach. For those patients who are asymptomatic for atrial fibrillation, does that mean that atrial fibrillation in and of itself doesn't cause problems? That's not true. Atrial fibrillation is a leading cause of stroke. Atrial fibrillation, if the heart rate is uncontrolled, can cause the heart to actually wear out and become weak and lead to people developing heart failure. Atrial fibrillation in some patients are quite debilitating in the sense that when they go into atrial fibrillation, they feel weak and tired. And frequently, these are people who already have a weakened heart. And more studies are now coming out showing that atrial fibrillation in certain populations of patients actually decrease survival. In other words, they die because of the disease. So when we start talking about treatment for atrial fibrillation, there's been a lot of controversy and a lot of inertia saying that it's not a bad disease. Well, what's interesting is when we look at the study which they refer to as atrial fibrillation not being a life-threatening illness, it's amazing when you look at the data and actually look at it. And that's because in the study it showed that 25% of the people died within 5 years. Now, follow-up studies have shown that that number was exaggerated. In other words, and I was involved with that trial, when we were trying to get patients in that study, we probably got some patients in there that were really, really sick versus more recent trials. But nevertheless, it does show that this, quote, disease which is without symptoms only if you exclude mortality. So anymore, my approach, and I think a lot of approach of the heart rhythm specialists, is to become more and more aggressive about the treatment of atrial fibrillation. One of the areas to be aggressive is prevent stroke. We know that a drug that we've been using for 50 years works. It's called warfarin. Most of you who are on it also call it rat poison. By the way, rats are immune to warfarin now. Then there are the new drugs, which interestingly, people were very, very terrified of, but they were all shown to be safer than warfarin. And these new drugs, many of you are on, and they're there to prevent stroke. They're easy to take. They're very effective. You don't have to get your blood tested. Unfortunately, they're also very expensive. What's most interesting, though, is despite the fact of people being on these medications and knowing that it prevents stroke, it turns out that about 25% to 30% of patients stop taking these medications within 2 years. And there's no clear reason why. In the studies that have been done, no one knew why. But then there's also another group of patients that are at risk for stroke and also at risk to be on a blood thinner. And what was developed was this thing called the Watchman device. The Watchman device closes off a part of the top left chamber called the appendage. This area called the appendage, around 90% of the clot that causes stroke associated with atrial fibrillation comes from there. And we've always thought that if we could close this thing off, or the surgeons would seal it off when someone is having open heart surgery. They would seal it off, that we could actually prevent stroke. And it turned out, yes, we can. And in terms of efficacy, it's about as good as warfarin is. But at this point, the Watchman really needs to be used for those persons who are at high risk for stroke, greater than 3% a year risk, and at the same time at increased risk for bleeding. And the question of increased risk for bleeding is always a very difficult one. I get patients sent to me to consider a Watchman, not because they're at increased risk for bleeding, it's because they are bleeding. Well, you know, I can't put a Watchman into that person because they're already bleeding. What I need, or the people who need a Watchman, are the ones that the risk of them being on a blood thinner is high for whatever reason, either because they've had a history of bleeding, because they fall, sometimes because they have vascular disease where they have to get put on aspirin or Plavix as well as their blood thinner. Because those are the patients who, on the combination of those drugs, have very high rates of bleeding, upwards of 10 to 20%. And this is major bleeding. So that's the Watchman device. Other treatments for atrial fibrillation, now we are doing a lot more ablation, and that is actually to try to cure people of atrial fibrillation. And if we can get to the person early enough in the disease process, it's effective. Problem is, we don't get to them early enough. Maybe in the future we'll get to everyone early and it truly will be curable. But right now, our success rate is looking at 60%.
Thank you. We have about 5 minutes left. I'm going to have one more question. I apologize to those of you that have asked questions and we did not get to them. But as you can see, we've had some great information shared today. So the last question, for when you stent a patient, whether it's cardiac or vascular, so you guys only got 5 minutes, is there a long recovery period and does it restrict my returning to work?
So anytime we do a cardiac catheterization, whether we place a stent or not, our recovery is going to depend on our access sites. Most of the time, we're using the radial artery, and we want to restrict the motion of the wrist for at least a couple of days. We want to restrict heavy lifting for a week. And we don't want anyone sitting in standing water like a swimming pool or a hot tub or a bathtub for a week to let the site heal up. For when we need to use the groin access or femoral artery, then it's a week of no lifting anything heavier than 5 or 10 pounds. Then stents don't really change that. If someone has a very physical job, if they get a stent in the setting of a heart attack, then we'll have some additional restrictions, and it's a case-by-case basis.
Just to add, the reason why we worry about this is we're making a hole in a high-pressure blood vessel, and the complication can be bleeding or something called a pseudoaneurysm, which is a pressurized sac that can impede function and cause pain. Some people use what's called closure devices or things to assist the blood vessel closing, but that doesn't change the fact that we have to have time to heal no matter what kind of procedure we do. If it's a small poke, in 2 days your body may have it healed, but it's really dependent on the individual. If you have diabetes, if you're on certain medications, it may take longer. So it's something we have to address on a case-by-case basis.
Thank you. That concludes our question and answer for our expert panel today. I would like to thank them all, and I feel very fortunate living in this community that we have these experts, not only with their own specialty, but you can see they work very closely together, and that we have this team of experts here at Henry Ford Allegiance, that we don't have to travel and go anywhere to get the excellent care that they can provide us and our families. And I just want to give a round of applause for them and thank them for coming out.
Again, thank you to our doctors. Go ahead and stretch your legs a little bit. Our next presentation will begin in about a little less than 5 minutes here. In the next 2 or 3 minutes, we'll have our keynote speaker coming up in just a couple of minutes, Eliz Green. She'll be talking about stress-proofing your heart. And we'll get started here in just a couple of minutes. So stretch your legs. If you're not in the sanctuary, head on over to the sanctuary. Our next presentation will be starting in just about 2 minutes. So come on in and grab your seat. Good morning, everyone. Thank you for coming out to our 16th annual Heart and Vascular Expo. Our keynote speaker will be about 2 minutes. Eliz, she'll be presenting in the sanctuary. If you're in the gym or the commons area, you may want to start heading over to the sanctuary to grab your seat. Again, that presentation will start in about 2 minutes. She'll be talking about stress-proofing your heart. Good morning, everyone. Again, our keynote speaker, Eliz Green, will start presenting here in just about 1 minute, talking about stress-proofing your heart. That will take place in the sanctuary, and we'll get started in just about a minute. Good morning, everyone. Thank you again for coming out to the Heart and Vascular Expo today. We are going to get started with our keynote presentation today, talking about stress-proofing your heart. So do you worry about the toll that stress is taking on your health or your quality of life? And if you have little ones like me, maybe even your sanity. Eliz Green has a couple things to say about stress. She's a professional speaker, a small business owner, and a mother of two 18-year-old twins. It's a busy lady. She's also conducting a research study on job stress and is on a mission to help us busy people feel better, protect our health, and get more of the important stuff done in our lives. And don't we all want more of that? So if you could please welcome to our stage, Eliz Green.
I am extraordinarily excited about stress. And I know that's weird, but it is what I've made the last couple years. My entire focus has been about stress, and honestly, it's the favorite thing for me to talk about, whether it's in an event like this or at the grocery store. You really can't stop me from talking about stress because I am fascinated by the chemical reaction that happens in our bodies when we perceive stress in our environment. It is a hardwired, evolutionary sort of reaction. When there's stress, a hormone in our body called cortisol is released, and it makes our body do certain things. Our heart rate goes up. Our blood pressure goes up. Our blood even gets thicker so that if we were injured, we wouldn't bleed to death, which is all great. Except when we live our lives up at this high alert all the time, it never has the chance to come down the way it's supposed to. It's supposed to go up there, like when the person pulls out in front of you in the car and you have to slam on the brakes, and your reaction is just that much quicker because that cortisol came into your system. Great. But it's supposed to come down when that goes away. And another thing I find really interesting is that your body doesn't know the difference between that car pulling out in front of you and a surprise birthday party. It's the same reaction. But again, once everybody yells, surprise, the cortisol level comes back down again. But if it stays up there, if we're living our lives at this high alert, then that cortisol starts to do some really kind of mean things to us. It makes us maintain weight around our middles. Mean. Doesn't let us sleep. Also mean. And eventually, it can harm our hearts, which is why I became interested in stress. It's one of the most important risk factors for heart disease, but it's probably the one that we don't talk about enough. So that's why I'm here. And when we talk about stress, it's often in this work-life balance thing that somehow work is supposed to offset life, or life is supposed to offset work, and we're supposed to find a balance in that, which never actually made a lot of sense to me. I would try really hard, and I would think, okay, now I got it all figured out, I have some balance, and then something else would happen, and all would go kaflooey again. But I had an idea of what that was supposed to feel like because I had this experience. This is me 8 days after our beautiful daughters were born. It was the first time that we held them together. They were born 2 months early. It was the first time we had them both out of the incubators in the NICU at the same time. And if you look closely, there are a lot of tubes and wires coming off of me because on the day that they were born that day because I had a heart attack. Fortunately, I was in the hospital on bed rest at the time, so I got great care right away. But I had a full cardiac arrest. I know you heard the difference between a heart attack and a cardiac arrest today. I had a full cardiac arrest. I did not have a heartbeat, and I did not breathe on my own for 10 minutes, which is a long time. Fortunately, I was in a hospital, got great care right away. They were able to restart my heart with the defibrillator. I went to the cath lab you heard about. They diagnosed what was wrong, and then I had open heart surgery. First, the girls were delivered by C-section, and I had open heart surgery to fix my heart. So those doctors that you've seen on the panel, I have visited all of those kind of doctors. And it's wonderful to have a health providing system in your community that can have such a variety of services, because I know I need all of them. So it's nice to have that in your own community and not have to go too distant. Another weird thing about this photo is because all of this happened right before Thanksgiving, there was a newspaper reporter that came and took this picture, which is nice because I love this moment. But it was weird to have media attention at that point in our lives. So a lot going on. But in this moment, I was the most content I had ever been. Because right there, I had everything I needed. Our babies were doing well, still tiny, but doing well. Had my husband. And even though my health was uncertain, that's all I needed, and I was content. And just this little bubble of contentment. And a couple of days later, we were visiting the girls in the NICU again, and it was really loud. There were monitors beeping and people talking and babies crying. And I turned to my husband, I'm like, wow, it is really, really loud in here today. He said, honey, it's this loud every day. You just didn't notice. Because I was in that bubble of contentment. And I thought to myself, aha. If I could just kind of hang on to that, wouldn't that be a nice thing to have in my life? Just focus on the things that were essential, that bubble. And in the years, I mean, it's getting close to 20 years now since that moment, I've tried to hold on to that. But truth be told, when I left the hospital, when we went back out into the real world, it's harder to hang on to that. And I've developed some things over time to keep that bubble safe, to protect it, so that all of the things that uncertainty of my health or whatever else came along in our lives, I could protect that. So I thought, okay, I know how to do that. That's just what I call vitality. Protecting that capacity to have a purposeful and enjoyable life. Isn't that what we all want? So I thought, okay, if I know how to do that, what I need is data around what's causing all of this stress and how bad is it? Because I know how to do this. If I can figure out that, I could be able to share it with other people. Great. So I went and did a research study on job stress. 4,000 people from all over the world, all kinds of different professions, all kinds of different jobs participated, and I got all this yummy data. Love data. Yummy, yummy. And one of the things that we discovered in this process is 7 out of 10 people are at a stress level that could be damaging to their heart. They're saying they are stressed at least half of the time. Some of them are saying they're stressed most of the time or all of the time. So that cortisol is causing a real problem for those people. 7 out of 10. So that's most of us. And that puts an incredible amount of pressure on the heart. And I started to think about, how do we let that pressure off so that we can protect our hearts, we can protect our emotional well-being, and we can protect that vitality, that capacity for a purposeful and enjoyable life. So I developed this little quiz. And in it, I talk about 100 chances to live to the ripe old age of 97, have all of your faculties in place, feel great, playing golf to the last minute, and pass away peacefully in your sleep. Sounds good, right? But when we talk about risk, particularly heart disease risk, that risk expands exponentially the more risk factors you have. So I'm going to demonstrate how that works, because it takes away some of our chances to live that wonderful, vital life until 97. Some of those risk factors are just things that we're born with: our gender, our ethnicity, our family history, that sort of thing. Based on those, you're going to lose some of those chances. You're going to cross some of them out. And then there's internal risk factors. These are the ones that you have to go to your healthcare provider and get tested. I just did my blood test. I have my appointment with my physician on next Friday just to check in. So I went and had my cholesterol and my blood sugar. She'll test my blood pressure when I'm there. So those things, based on that, you're going to lose some more. There we go. And then there's lots of ways to talk about this. This is the one I like the best. The waist to hip ratio. I think it's easier to understand than the BMI calculation. So we're all shaped differently, right? So we're going to find the place that's the widest down here, and the space that's the narrowest somewhere here. You're going to measure both those things. Women, we want this area to be about 80% of this area. So we want to be curvy. Men want to be straight. But we don't want to be round. And there was a book out several years ago called the Apple and the Pear. It's the same concept. So the idea is, remember I said that when our cortisol levels are high, it makes us hold weight around our middles? That's to protect us. If your body is saying, ooh, I am in danger, I'm going to protect myself, it holds. So we're not letting our bodies release that when our cortisol level is always high. And we don't want fat around our middles where our organs are. If it's down here, that's okay. But up here, it's a problem. So based on that, you can double your risk if you're round rather than curvy or straight. Smoking, we all know, if you live or work with a smoker, it doubles your risk. If you are a smoker, it triples your risk. So you could lose a lot more chances that way. And then we talk about stress. So for those 7 out of 10 people who said that they were stressed enough for it to make a difference, they're going to increase their risk by half. For those 3 out of 10 people, so 30% of people said they are basically stressed all of the time, they double their risk. So think about it. Those chances right there for stress has exponentially increased your risk. It's what I call the physical impact of your stress. So it makes a difference. That's why we need to pay attention to our stress, so that we make sure that we're not seeing sort of the gentleman at the end of the table. We'd like to avoid that open heart surgery if you can. I mean, I'm grateful for my surgeon, don't get me wrong, but I'd rather you took care of this and not had that experience. So that all sounds kind of scary, right? But there are some things that we can do to make sure that that stress doesn't end up impacting our physical health. We just have to help our bodies get rid of cortisol. We are naturally designed to do that, to get it out of our bodies. We just have to help our bodies do it. So we're going to process the cortisol out of our bodies. And the first way, my favorite way, is to go up, to come down. So anytime your heart rate goes up for a few minutes and then comes back down, it takes cortisol with it. Great. All right. I am a Minnesota girl. I'm a hockey fan. Any other hockey fans? Basketball, football, something? Yeah. So when you're watching a good game and you may or may not be yelling at the television, like, go, go, go. Heart rate goes up, right? They make the goal, whatever your sport you're watching, and you go, yay! And then you sit back down and have that like feeling. It's going up to come down. Your cortisol is going down. Now, if your team loses the game and you're mad about it for a week, that's not a good strategy. But anytime you get your heart rate to go up and come back down, you're helping your cortisol, plus you're doing something good for your heart to get it exercise. So clearly exercise is a great way to do that. I am a big fan of having an enthusiastic exerciser as a workout partner. Here's mine. Her name is Maisie. She is an Australian Shepherd, and she is ready for a walk anytime. But if you are not an enthusiastic exerciser, I would count myself as a non-enthusiastic exerciser. Having somebody in your life, whether that's a person or a dog or however it's going to work for you, who will get you up and going is really helpful. So think about who are the enthusiastic exercisers in your life. And it works just as well if you're talking to somebody on the phone as you both are walking. It's thinking about how can you partner with somebody else who will get you up and moving. Because the more you move, the more that cortisol gets out of your body. Now, I recognize that you've probably heard that before. And sometimes people are like, I am a big fan. I think I shared that I'm a big fan of data. So I'm a big fan of the Fitbit. Is there anybody else who has a love affair with a pedometer of some sort? Yes! Oh, I love seeing that. Awesome. So I love anything that gives me data. I find that motivating. The other thing that I love about the Fitbit is it allows you to compete with other people. Particularly, I love to compete with my sister because we're sisters. That's sort of just baked into the sister relationship, right? So I track her on the iPhone. There have been times where she's like on the treadmill at 9:45 and I'm like, isn't it time you go to bed? She's like, how about you go to bed? But we're always looking at who's going to win this week, which is a great strategy. And if you can get 10,000 steps per day, that's equivalent to 20 minutes of cardiovascular exercise, which is great because sometimes it's hard to make time to get that 20 to 30 minutes in. But if you spread it out throughout the day, that works really well. Now, the reason my sister is hard to compete with, however, is that she cheats. Yeah. Now, and I'm not talking putting it in the dryer, because that's actually cheating. But she gets out of the shower in the morning and proceeds to brush her teeth like this. So she's moving all the time while she's getting ready. When she's on the phone, she works for a U.S. congressman in his local office. She's on the phone, she's up and moving like this, which I know because I stalk her on the Fitbit app, right? Right. But she's really smart because anytime she's on her feet, she's moving. Now, I would suggest if you are standing in line at the grocery store it is better to have the earbuds in because somebody thinks you're just listening to a great song as opposed to like a little out of your mind. But really, if you think about anytime you're on your feet, just moving a little, that's a great way to not only make yourself feel a little better, but get rid of some of that cortisol. In fact, let's try that. I encourage you to stand up with me. And we're gonna, for those of you who have a pedometer, we're gonna get a couple steps in for you. But if you don't, let's pretend we have one on and just give it a little side to side. If you really wanna add a little something, you add a little step to the side. So that's not that hard, right? Could you do that while you're brushing your teeth? Could you do it while you're combing your hair? Or shining your head, whatever works. Now, ladies, if you were gonna do your makeup, you do have to stop for the eyeliner and the mascara, because that's just not a good idea. But think about where in your life you could do a little bit more of this. Now, if you are not somebody that this is gonna work for, whoops, I shut it off. Thank you, everybody. Just sitting in your chair and pumping the arms can have the same effect as doing that. So a little swing, swing, swing does the same thing. I know because I do this when I'm low on steps. So finding ways to go up to come down is a great strategy to help your body get rid of that cortisol. There are other ways to do it. The next one is sleep. Sleep is the most efficient way to get cortisol out of your body. The mean thing about cortisol is it makes it hard to get to sleep, and we're going to talk about that in a little bit. But sleep, I like to say, is the magic ingredient that makes everything else work. You can eat right, you can exercise, you can do all the things right, but if you're not getting enough sleep, the cortisol doesn't have a chance to get out of your body, and it does all those mean things like make that fat stick around your belly. So sleep is really important. And then changing your breath. Now, if you were here for Kate, when we did yoga, she asked us to stop and change our breath because when we're stressed, we tend to breathe very shallowly and very quick. So doing something like yoga allows you to let that go. But not all of us can sit and listen to our own breath. Sometimes that drives us a little nuts, and that's okay. We're all different. But there's other ways to change your breath. Singing is a great way to change your breath. So singing in your car on the way to work, great stress management strategy. Or on the way home, wherever, crank that tune, sing at the top of your lungs. I had a woman recently tell me that she has a walking into work playlist that is timed so that it takes her entire drive to work, and she sits in the parking lot until the last song plays and sings at the top of her lungs, and then walks into work feeling great. For her, it's Beyonce. She's ready to roll. So you think about where are those transition times in your day where you could put on some tunes, sing at the top of your lungs, change your breath. Because when we change our breath, we just feel better. It's why laughter works, because when you laugh, you change your breath. So if you haven't laughed in a while, I would just encourage you to Google pancakey wife. That's my gift to you today. Google it, watch it. It is my favorite funny video. I can't even count how many times I've watched it. It makes me laugh every time because the woman on it just has this infectious laugh. So anytime you can change your breath, kind of break that rhythm of that stressful breathing, that allows the cortisol to come out of your body. So doing those things really makes a difference. So the idea is if we practice these things, if we move a little bit more, if we get more sleep, if we change our breath, we can reduce our risk, not only reducing that exponential amount we got from stress, but all of those activities help us reduce other risk factors. And we can get back to the stuff that we couldn't change. Our gender, our age, our ethnicity, that sort of thing. So is having that sort of impact worth doing a little of this? Sure. Some of it is actually kind of fun. So the whole idea is making sure that we get that cortisol to release out of our body. But it can be hard, as I mentioned, if those things that are stressing you out are constantly knocking at your door, right? They're like, hello, it's 3 o'clock in the morning. Could you think about how long that retirement fund is going to last? Could you think about layoffs at work or whatever it is that is causing you stress? It's like, ding, 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 ding. Hello, pay attention to me. So it's very hard to let go of that. And one of the interesting things that I found in my study is what is causing all of the stress. Because again, when we think about stress, we often think about that work-life balance piece. So what do you think, what color up there do you think represents people in my study who work-life balance issues were their top stressor? Just call out a color, what do you think? Red? I would have thought that too, but it's actually blue. I know, weird, right? So while I love data, I am not an Excel spreadsheet expert. So I had someone help me design this so I could crunch all the data. And when this came up, I called her and I said, I don't know what I did, I broke it, because this was not the result that I was expecting. 7% of people said that their number one stressor was something related to work-life balance. She said, no, that's what your data said. So the red is overwhelm. The yellow is something to do with uncertainty. The green is work culture, work environment, that sort of thing. And the blue, that little slice, is work-life balance. Now, for the people who are experiencing that, that's very stressful. So that's all of the people in the study. 7%. And I thought, okay, but that's men, women, everybody. What if I just looked at women? Surely that would make a difference. Nope, still 7% of them said work-life balance issues were their top stressor. But the number one specific stressor in that group was my job is negatively affecting my health. That was their major stressor. Men said the same thing. So I thought, okay, but that's women. What if I looked at women with children under the age of 17 living at home? Surely that would make a difference, right? Nope, still 7%. Now, their top stressor was caring for children. 7% of parents, or 7% of people who are parents with children living at home under the age of 17 say caring for children is their top stressor. Which makes sense. I kind of wish we would have asked how old the children were. Because my bet is for those people who say that that's their top stressor, either their children are under the age of 3 or high school juniors. Yeah, that's a stressful period of time. And it's true. Having just done that, that's a really stressful time. But if we are treating, and the interesting thing about it, not only did all the moms say that, the dad said the exact same thing. 7% of them said caring for children was their top stressor. For them, that 7%, that's very stressful. But if we treat everybody thinking that that's what's causing stress, we're missing the boat. So when we go back and look at the fact that the majority of stress is caused by overwhelm and uncertainty, those are things we can't control. We can't control how many patients come through the door. We can't control how many customers come to our counter. We can't control whether or not the economy changes, right? Those are things that we can't control, but they're the major stressors. That made a lot of sense to me. I remember how overwhelmed and uncertainty felt when the girls were little and my health was uncertain. That sounded very familiar. The idea that all of these things are just swirling around that I can't control. But if we could just make a little space in the middle where we could live and work well, that's really the idea of stress proofing. You just sort of make space for that. One of the pivotal things we need to do for ourselves in that process is to shut down that cortisol reaction, those things that knock on our door and say, hey, pay attention to me. We need to be able to shut down that cortisol reaction so we can allow our bodies to recover. Because again, I said, if we don't let it come down, it causes all kinds of problems. And a lot of the time when we talk about disconnecting from our stress, people say, oh, well, you just need to relax. But that looks different from different people, which really came, in my mind, to a point when we went on vacation for my husband's 50th birthday. It was kind of a special thing. We went on what I like to call a warm toes vacation. We live in Wisconsin, so we're all the same here. Like sometimes you just need to have your toes be warm for a little bit, and whether that's putting them up by a fire or you're going someplace that's warm, it's good to warm up your toes every once in a while. So we went someplace that had lots of sun. My husband likes to scuba dive. That was his big adventure for his 50th birthday. And we went with a couple of other couples, and they very much enjoyed the pool. They would lay by the pool after going scuba diving. I don't scuba dive. They went and did that. I had other things to keep me happy. But they would come and they would lay by the pool and read their book and chat and take a little nap, drink a little beverage, have a little nap, drink a little beverage. But they were happy in the pool or by the pool in the sun. There were actual iguanas that would come around the pool. I didn't know iguanas could swim. But they were hanging out with iguanas, so we began referring to our friends as the iguanas because they were just hanging out at the pool with the iguanas. Now, my husband cannot sit still that long. So we would go to the pool for a little while, and then we'd go swimming in the ocean and then come back, or we go to town and we come back, or we went shopping, or we come back, we go sail the little sailboat and come back. And we were in and out and in and out. Till at one point, one of the gentlemen said to my husband, when are you going to relax? You're go, go, go all the time. And my husband said, I am relaxed. If I don't have something to do, I start chewing on things. I'm like a border collie. I'm like, oh, he is like a border collie. I mean, he's not actually physically chewing on things. He's chewing on things in his head. He's thinking about those things at work that he can't let go of. He's like a border collie. He needs to be occupied. We have an Australian Shepherd. She needs to be occupied. She's a much better behaved girl when she's tired. And it was one of those times where suddenly your marriage makes sense. Like, oh, I am a little more on the iguana side. And so sometimes in our vacations, we're go, 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 and I'm not getting what I need because I really would like to sit and read my book for a while. So in our relationship, it has really started to take on a life of its own. Because I need iguana time and he needs border collie time. One's not better than the other. They're just different needs. So when we live in Milwaukee. We sail across Lake Michigan to come to the beautiful western shores of Michigan. And he loves to go bike riding and go poke around all the little shops and everything. And we'll have that border collie sort of day. But then, at one point, we got down to the beach. And it was beautiful. The sun was sort of late afternoon, and it's kind of distant off there and sparkling on the water, and the waves are coming in. He said, "What do you want to do now?" And I said, "I'd like to sit here and watch the sunset." He's like, "It's an hour tour sunset." I'm like, I would just like to watch that whole thing happen. Now, he was fine. He had his camera, and he took beautiful pictures of those waves rolling in, and he was occupied, and that was fine. But I watched the sunset. And I got to sit next to my wonderful husband and hold his hand and watch it sink into the lake. And that was great. I could put up with an awful lot of border collie for just a little bit of iguana time. It's really about understanding what you need to disconnect and let your body to recover. Because my husband is 100% border collie. But I kind of exist somewhere in between. Sometimes I need a little quiet contemplation. Sometimes I need to be highly occupied. And I think we all are like that on some level. And I want to explore that a little bit. And I know that people really participate much more enthusiastically if there's a prize involved. So in order to figure out whether you're more of a border collie or an iguana, I have some scenarios. Some of them need a little bit of just go along with the idea. But I'd like you to think about what you would like to do in these scenarios and whether it's more of a border collie thing or an iguana thing. And if you choose to participate, I do have copies of my new book. This isn't even out yet. It's a special advanced printing edition. It releases on April 21st, but I have a few copies to give out today. So the first scenario I would like you to think about is, let's talk about a Saturday, maybe next Saturday. And miraculously, you do not have any obligations. You don't have to take care of anybody. You don't have to make anybody food. You don't have to drive anybody anywhere. You don't have to do anything other than what you want to do for the hours between noon and 4. If you have children, Mary Poppins is in town and she has taken them over to her house. They're good. If you are caring for a family member, Mary Poppins is taking care of them. So you have no obligations. Think about what it is that you would like to do with those 4 hours. If you have something you'd like to share, raise your hand, let me know. I'll come back to you. Okay, hang on.
I'm like the border collie, and my husband's the other one. And I would like to go to my daughter's house and help her organize her basement.
Excellent. All right, thank you. So I love this answer for a couple of reasons. I did recently do an event where a woman said that she would go home and clean out her closets, and she was booed. Like, oh, why would you do? But I think disorganization, especially when you don't have the time to put things in order the way that you would like them to be, can be very, very stressful. And it's one of those things that you get to step back and say, I did that. And so often we don't have the satisfaction of completing something because we're always moving on to the next thing. So to find something that hits so many ways that would maybe reduce your stress, you get that feeling of satisfaction, you get things organized, it's a little bit physical. I love that. You were next.
I think I'm more than iguana because I would maybe like go catch a movie, something I haven't seen, because I don't have cable at my house. I just because I work and I'm so busy. So that would be the thing I would do. Would just have just a chance to breathe because I have a really busy job, fast-paced job. So that would be ideal for me.
Fantastic, thank you. And does anybody else have a guilty pleasure television show? I will admit to mine, which is Say Yes to the Dress. I used to work in a bridal shop. All that stuff is true. It's like that. None of it is made up. So the say yes to the dress is one of those things that I just love to watch because it's very distracting and it makes me laugh and it's fun. So I think screen time often gets this bad rap, like, oh, that's bad for you. It's not like if you're spending your entire day in front of a screen, maybe not great. Get up and walk around a little bit. But sometimes that screen time does allow you to sort of disconnect and have that moment to go, yeah. Yes, ma'am.
Well, mine would be an organization thing because I have a computer room that's a disaster right now. I have a basement that's a disaster right now, and it stresses me out. I go down there to do it, and I'm just like, oh, I don't have any time to do this, and that would be my thing. I would just completely organize those 2 rooms that need it so bad. And I like to organize, I just don't have time.
Yeah. It's hard to find the time sometimes. And it's also hard to find the permission sometime to take that and prioritize it because there's always something else you could be doing. And one of the things I hope that you all take away is these activities are really important. That especially when you're combining a number of things, right? So you're combining the stress relief of getting something organized. You're combining that with some physical activity and that disconnecting from what's stressing you. So these are high potency stress management activities. But it's like, oh, well, that's way down here on the bottom of the list of things that I'm going to do. Give yourself permission to put it at the top of the list because you're going to feel so much better. All right, let me give you another one. Let's say it is Friday night. You have, the numbers on this have changed over time. I used to say $100, and then people were saying, well, if you're going out with 2 people and you're going to get a babysitter, and, okay, so you have $500. I know, right? $500, again, if you have children, they are staying overnight at Mary Poppins' house. If you're caring for some other person, Mary Poppins is taking care of that person. If you have a designated driver, if that is a stumbling block. So all of your needs are taken care of. You do not have to take care of anybody else. What would you like to do with your Friday night? I'm going to come over here.
Live music.
Oh, I love that. Live music and art in a public place?
Yeah. With other people? Yes.
Okay. Here you go. She said it's her drug, live music. So are you playing or listening? Listening. Music is one of those things that, if it's your jam, is great. Not only listening to music, but also playing music. And that is one of the things when I ask people, what's the thing you used to do that you love doing and you just don't have the time to do anymore? Music is one of those things that bubbles to the top. Okay, oh, I used to love to play the guitar just for me. Or I played the piano, or I used to love to sing in the choir. As we talked about, singing is a great way. So singing in a choir not only gets you the opportunity to change your breath on a regular basis, be a little bit social, which some of us need. Some of us need to back away from social activity if you're in a job that has you around people a lot. But that creative piece, too, can be really, really important. You have had your hand up the whole time, so you get my last one.
I'm the dog one. I like to organize and bake, and I have 11-year-old and a 6-year-old boys, so it's a lot of laundry, bacon, food, keeping everything organized because I get their drawers organized. They look for something to get dressed in, the fling, and so yeah, it's a lot of organization, and I I like to stay busy for the most part.
And there's a lot of us that need that activity just to keep things going. It's a trap sometimes that we often feel the pressure to be busy and be doing all of the time and not give ourselves the opportunity just to stop and do something for ourselves. So I hope that's something you're taking away. Did you have a comment?
She's the first one that mentioned food because the lunch and the evening plan was all going to be around eating, taking friends to lunch and taking friends to dinner.
Oh, I love that. Yeah, because we spend a lot of our most important times around food, right? And food, I'm glad you brought that up because one of the things that I love to do is talk about food. And in fact, I do a podcast with a friend of mine called the Food Bullying Podcast because we talk about the things that we do to each other that are judgmental about our choices in terms of what we're eating or what we're buying. I think food should just be a celebration. Like, it is what we nurture our bodies with, but we should also be nurturing ourselves with it. So thank you. I appreciate that. If you didn't get a chance to have a book, I'm sorry. But I do have these little cards in the back to let you know how you can get one. So the idea is to figure out where you are on this spectrum between Border Collie and Iguana and just give yourself the permission to do the things that will allow you to disconnect and have the time to recover. Because when you take care of those things, you have a much better capacity to have that purposeful, enjoyable life. So we talked about a number of things. We talked about getting your body to let go of that cortisol, whether that's moving or changing your breath or making sure that you're getting enough sleep. And we talked about how to shut down that reaction so that your body has a chance to recover from the things that you can't control. So as we move towards that idea of vitality, I know that information very rarely makes us do anything different. You're going to walk around and you're going to get a lot of great information today, which is wonderful. But we have to do something with the information. Learning is only part of it. We have to find the motivation to do something different. And for me, I knew what I was supposed to do. You know, I had a heart attack, open heart surgery, C-section. That's a lot to recover from. And I did pretty well at the beginning. I went through cardiac rehab, which is really important when something happens to your heart. You think walking around the block is going to be a problem. So you go to cardiac rehab and they put the little monitors on you. You go on the treadmill and the bike and all of that sort of thing. And you regain strength and stamina, and that is all good. But the most important thing is you regain confidence that this is all going to be okay. So I left cardiac rehab, got my cute little certificate for graduation, and I was supposed to go home and do 20 minutes of cardiovascular exercise every day in order to make this heal. But I had infant twins, I was recovering from surgery, and I was tired. And much like your basement, that exercise was way down at the bottom of my list. Everything else was more important. And so you would think that having a heart attack at age 35, okay, I'd be the biggest workout queen in the world. But I just wasn't doing it. In my former life, I was a dance teacher, so getting exercise was just part of my life. I was on my feet all day. And now I'm at home, recovering with babies and tired. So I really wasn't doing it until one day my husband set me down and he said, "Honey, I see what you're doing. And more importantly, I see what you're not doing. You're not doing the work to get better." And I told him all of the things that were on the list that were more important, the laundry and the baby. I had a big long list of things that I needed to do every day and why I couldn't do this last thing on the list. Because honestly, the last thing that I wanted to do is get on the stupid bike and the stupid stand in the stupid family room and do 20 minutes. Hated that bike. But he said, none of that other stuff matters. If you're not doing the work, you're not going to get better. If you don't get better, you're not going to be here. And if you're not here, our family doesn't exist. And in that moment, I saw all the things that I didn't want to miss with my family. I wanted to watch those little babies grow up and go off to kindergarten, go through middle school and high school. It was really great to watch them walk across the stage and get their high school diplomas. I did not cry when we dropped them off at college in their presence. I cannot wait to see what they do. I want to watch them fall in love. I want to dance with my husband at their weddings. I want to welcome their children into our lives. And I want to sit with my husband and hold his hand and watch the sunset night after night after night. I know none of those things are given. I have to do the work to get there. We all do. These people, they're my whole world. They're why I got on the stupid bike. They're why I don't eat fried chicken at every meal, and even though I really love it. They're why I make sure that my stress doesn't impact my health. So as you leave here, I ask you to think about who's your whole world. Oh. What moments do you want to have that makes it worth doing the work? Doing what that information tells you you need to do. Pick one thing. Don't change everything all at once. Pick something small. Is it just doing this a little bit more? Is it rejoining the choir? Is it making time to reorganize your basement to make yourself feel better? Whatever it is, connect it to the thing that makes it worth it. Because I know for sure when you connect the information with the motivation, that's when change is possible. I'm a big believer in writing things down, and I encourage you to just think about the promise that you will make to yourself over the next 30 days. Finite. In the next 30 days, what will you do every day for yourself? A little bit of this, a little bit of paying attention to how much you're sleeping, whatever it is, write it down. Say, I will do this because I want whatever will make it worth the work. That's when change happens. Now, I know that I threw a lot of information at you, and there's a lot of information here, and I encourage you to go around and get all of it. But I also know that one of the things that happens when we try to make a change is we kind of step off the path, and then we're like, well, I messed that up. That's not going to work out. Here's something I say to myself every day. Life is not about perfection. It's about moving in the right direction. There are times that I am going to have fried chicken more than once a week. That's all right. Get back on the path. So if you take a step off, just get back on. What's important is you keep moving. Keep moving in the right direction. So I hope that you have found something today that's going to help you on your own path, whether it was in here or in all of the opportunities you have around this whole building. Take it, connect it with your motivation. Don't beat yourself up if you stumble a little bit. Because I know if you do the work, you are going to have a stress-proof heart. You're going to be able to withstand whatever is swirling in your environment and have that purposeful, enjoyable life. So, did I mention I used to be a dance teacher? I think I did. I can't leave people sit for too long, so I'm encouraging you to stand up with me one more time. And I'm going to send you out to lunch feeling really great. And I would encourage you to come back and hang out with Katie, who I think is doing another yoga thing after lunch. Could we go back to my last slide? I'm sorry, I don't know what I did. Sorry about that. All right. So I'm going to hang out. So if you have questions for me, I'm going to hang out here or hang out in the back. Just come, we can chat. I got lots of time. Don't have to be at the airport for a little while. So I appreciate you coming out and hanging with us. Is that the last one? There. So I'm going to encourage you to stretch up as tall as you can. And just because we sat for a little while, oh, that feels good. And then come down. And I'm going to have you plant your feet so your belly button's facing this wall back here. And then we're going to leave our belly button facing that wall, and we're going to push one hand forward and one hand back, and look behind you back towards where lunch is going to be back there. Nice little twist to stretch, and we're going to go the other way. All right, here's my favorite thing. You ready? We're going to squeeze our hands as tight as it'll go, your arms as tight as it'll go, your shoulders, your neck, your face, your booty cheeks, everything you have. You're going to squeeze it hard, and then we're going to take a deep breath and let it all out. That's a good one. We're going to do that one more time. Squeeze your hands, your arms, your neck, your face, your everything you have. Take a deep breath. Let it all out. Thank you for coming today. I really hope you find something to help you on your path. Go out and have a great rest of the day. Thanks so very, very much.